Thank you.
Thank you, Madam
Mr. Rowe?
Thank you, Madam Chair. I'll issue 3 words dreaded by any politician. I'll be brief. This amendment is a repeal of the Independent Medicare Advisory Board. And Ranking Member Dreyer and members of this committee, thank you for the opportunity to testify in support of my amendment, which is extremely simple in its intent. I'm proposing that we agree on a bipartisan basis to strike the Independent Medicare Advisory Board from the legislation and restore congressional authority over Medicare policy. My Republican colleagues and I have been talking for months now about how we believe the underlying legislation will result in a government takeover of health care and will result in rationing of care. And no provision in the bill makes this possibility more likely than this board. You see, this commission's sole intention will be to determine whether Medicare is spending more than it is budgeted and, if so, to offer fixes to cut back on Medicare spending that are then fast-tracked with very little opportunity for congressional oversight. Some of my colleagues have heard me tell about my experiences we've had in Tennessee in a program called TennCare. But for those of you who haven't, let me be brief about this. TennCare was our state's solution to an ever-expanding Medicaid budget and was billed as the nation's first experiment with a Tried universal care. What happened was that the program overpromised benefits and made no effort to ensure the capacity to deliver those services ever existed in the state. And over time, our costs tripled from the initial projections, and we had to ration care by closing the enrollment and implementing limits on the number of physician visits allowed in 1 year. This year, you can only see a doctor 8 times, no matter how many times you need to see them, and the state will only pay a hospital $10,000 regardless of what your bill is. If anything is clear under the current proposal, it's that we haven't learned the lesson my state provided. This Medicare Commission is not going to be looking at how you improve patient care. It's going to be looking at how you meet a budget, and that harms patient care, period. In the past, these commissions have looked to cut physician payments first, and then when physicians stop covering services, they cut back on the number of procedures that are allowed. Fortunately, previous commissions, like the Medicare Payment Advisory Commission, made non-binding recommendations. Some Congress adopts and others it doesn't, but at least the decisions are reviewed. Now we're creating a system in which all of these flawed recommendations will become law. I'd like to read a couple of sentences from a letter here I have about the board, and it's signed by 75 members. An executive branch Medicare board would also effectively eliminate Congress's ability to work with the Center for Medicaid and Medicare Services to create and implement demonstration and pilot projects designed to evaluate new and advanced policies such as home care for the elderly, the patient-centered medical home, new less invasive surgical procedures, collaborative efforts between hospital and physicians, and programs designed to eliminate fraud and abuse. National policies that would flow from such a board would ignore the significant differences in health care needs of states and communities. All the providers in all states would be required to comply, even if these policies were detrimental to the patients they serve. Such a commission could not only threaten the ability of Medicare beneficiaries, but of all Americans to the access they need. Now, that's very strong language, but it's not my language. I ask for unanimous consent to enter in the record a letter authored by Congressman Neal from Massachusetts and co-signed by 75 members of Congress on a bipartisan basis, including Mr. McGovern, on this committee. It's clear that the members on both sides of the aisle share my concern that this board threatens patient care, so why can't we agree to remove it on a bipartisan basis also? The American people deserve better than this proposal before us, and I urge the committee to allow the consideration of this amendment on the House floor. And I'd like to have signed that submitted for the record.
Certainly. Are there any questions, Dr. Rowe? Thank you very much, Dr. Thank you. We really appreciate you being here.
Thank you for having me.
Mr. Cassidy.